It affects most organ systems in the body. When you're not eating very many calories, your body has certain ways of defending and keeping you alive, and most of it is to do with reducing your energy needs. People with anorexia, their heart rate slows considerably and their blood pressure drops.
G'day, and welcome to Wellbeing. I'm Jack Hodgins. Today we continue looking into anorexia nervosa from an academic perspective. We are talking with Dr Walter Kaye, Executive Director of the Eating Disorders Center for Treatment and Research, University of California, San Diego. Dr Kaye's research seeks to understand why individuals develop eating disorders, and then uses what is learnt to develop more effective treatments. He has authored more than 300 articles and publications on the subject, and through his treatment work, works closely with parents of children with anorexia. Hello Walter, and welcome to Wellbeing.
Well, thank you.
Many have heard the term anorexia, but what actually is it?
Well, this is a disorder that tends to occur mostly in women, and it's a disorder where people often see themselves as, being too heavy and desire to lose a lot of weight and restrict their eating. But some people also binge and purge.
Why does it occur?
Well, that's a very controversial kind of area. There's actually a lot of evidence now that there's a genetic transmission of anorexia that it tends to often run in families, and so we're kind of in a state right now where we're trying to understand more about the genetics and how that may contribute to developing anorexia. But there's also a lot of hypotheses about psychosocial contributions to developing an eating disorder, and we're probably somewhere in between those two somewhat opposite points of view, but there's probably both psychosocial reasons and cultural reasons as well as biologic reasons.
How prevalent would you say that it is?
And it occurs in roughly about 1% of women.
And what is the usual onset that usually occurs?
Very typically, it tends to occur in adolescence, somewhere around puberty.
Are there different types of anorexia nervosa, or is there only one type?
Most people with anorexia restrict their eating, but some people kind of alternate that with binge and purge behavior where they overeat and then will do something to purge, usually vomiting. And then there's another eating disorder that's also co-transmitted in families. That is, you can have anorexia and have a relative with just bulimia nervosa. And people with bulimia nervosa tend to be of a more normal body weight. They don't often lose as much weight as people with anorexia. There's also other eating disorders like binge eating disorder, which happens in somewhat older, more mixed population where people tend to binge, they overeat, but don't necessarily purge.
How drastically can the diet change as someone's anorexia kind of gets worse?
What we see is people eat very little, maybe a few hundred calories a day, and it tends to be food that is kind of low in calories, and they tend to avoid what most people would consider kind of palatable foods that are high in fats or sugars.
How does that affect the body? Because that seems like very low calories you mentioned there.
Yes, it does. It affects most organ systems in the body. Just think of this way: when you're not eating very many calories, your body has certain ways of kind of defending and keeping you alive, and most of it is to do with reducing your energy needs, so that people with anorexia, their heart rate slows considerably and their blood pressure drops, which is one way of kind of conserving energy. And there's also a lot of different hormonal and other chemical changes in the body to deal with being malnourished.
Can it affect the mental health of someone?
We often see people with anorexia tends to be associated with high rates of anxiety and sometimes obsessive compulsive disorder and sometimes depression.
Does it put I'd imagine that it could put a lot of strain on the heart, anorexia.
It does. The heart rate slows quite a bit, and you lose muscle mass, and you can lose muscle mass in your heart too. So the thing that's really concerning about eating disorders is that there's a fairly high death rate, people with anorexia and bulimia, and so people literally can starve themselves to death.
And I'd imagine too, building on top of that the internal organs wouldn't fare too well. What are some of the damages that it can do to the internal organs?
One of the more common damages is to the bones, and people's bone growth is maximized during adolescence, and there's an interval in your life where you're going to develop your maximum strength in your bones, and if you miss that growth period, which often coincides with anorexia, the course of anorexia, then people's bones may never fully become as strong as they might otherwise, and they may have lifelong bone weaknesses and be susceptible to many fractures.
How do we frame anorexia? What's the diagnosis? Like, what does someone have to show to be diagnosed with anorexia?
One of the common things with anorexia that's very different than most people, if they go without eating for a day or two, food becomes kind of more rewarding. It tastes better, and you feel very uncomfortable when you get really hungry. And people with anorexia often show a very different picture. There's something about food, they're just thinking about food that makes them very anxious, even if they're very underweight. And so consequently, there's this kind of fear of eating, which is very different than what happens to most people when they diet. So that's one of the things that we use to kind of help diagnose anorexia. The other is people see themselves as being overweight even when they're very malnourished. So that's a very common part of the diagnosis.
Does it affect the genders differently? Is it different? Does it look different in females to males?
Well, there's a very different ratio because roughly just a minority of people with anorexia are males, but it's probably more common in males than we recognize. And in a lot of ways, it's very similar, but sometimes it can be very different.
Do those with anorexia go through social withdrawals?
Yeah, that's pretty common to have a kind of being anxious in social situations and getting so caught up in the symptoms that other things in life become kind of less important.
And I'd imagine that if people are pulling away socially, that would affect relationships also with family members.
Yes, family members become quite frantic because they see their child really starving in front of them, and it's very hard to get them to eat and gain weight. And so this often leads to a lot of stress and conflict at home.
Have you seen, Walter, a rise in anorexia due to, say, social media?
Those things are very hard to, quantitate. I think we're still at a stage of anorexia where we're trying to better understand the causes of it. And now that we're developing more powerful tools to really be able to look directly at the brain and genes in the body, we're finding that there are changes in brain neurotransmitters and genes that may explain, contribute to having anorexia.
Can anorexia cause loss of fertility, or can it affect pregnancy?
Yes, very much. When people lose a lot of weight, one thing that happens is they stop having menstrual periods. It's the only way the body tries to conserve energy. And so it may be very difficult for people to both either get pregnant or sustain a pregnancy when they're that malnourished.
Say if they develop anorexia during pregnancy, would that affect the baby?
That's a good question. Certainly with enough malnutrition, it makes sense to think that it could affect the baby.
All right, and how much can it affect the lifespan at all, anorexia? Can people that have anorexia have shorter lifespans?
Well, there is a very high death rate in anorexia. In fact, it's been proposed that maybe the highest death rate of any behavioral disorder. So 5% or more of people with anorexia, will die of anorexia, which is a pretty high death rate.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Walter Kaye from the University of California, San Diego, where we are discussing anorexia nervosa. We mentioned when the onset kind of happens, but are there any age groups where that it's really prevalent in?
It starts usually in early adolescence.
Okay. Can it affect people after that as well? Can it develop, say, in the middle when you're middle-aged?
Yes, we've certainly seen people that are older in middle age or even elderly develop an anorexia-like picture.
And I would imagine that the older someone is, if they were to develop anorexia, it would put a bigger strain on their body than, say, if someone was younger and developed it.
People are just less resilient as you get older. You just don't compensate as well.
Okay. Is anorexia just the fear of like putting on weight, or is it a bit deeper than that?
Well, I think it's a little deeper than that. One of the things about anorexia is, although we call it an eating disorder, the question is there really a disturbance of appetite regulation? Some of the research would point to the likelihood that it's actually a disturbance of how appetite is regulated in the body. It's just not so simple as it's kind of complicated.
How long would you say does it take for anorexia to kind of develop?
Yeah, it's a hard question to answer because there's a lot of different courses of people with anorexia and different mixtures of symptoms. But generally speaking, we'll hear somebody develop anorexia, over several months or over a season.
With eating disorders, there seems to be this, when someone mentions anorexia, they always mention bulimia as well in the same sentence. What are the differences, though, between anorexia and bulimia?
People with anorexia tend to restrict their eating. They'll eat, very few calories a day, maybe several hundred calories a day. People with bulimia will actually, our studies suggest that they kind of alternate restricted eating with binging and purging. So there are times that they'll restrict and times that they'll overeat, and then follow that by purging.
What parts of the brain does anorexia directly affect?
Well, it affects all parts of the brain. If you do brain imaging studies, what you'll see is kind of a shrinkage of the brain. We don't really understand why that is, but it may have to do with changes in nutrients and fluid balance. And that tends to normalize with better nutrition.
You mentioned that the brain can shrink a bit. And so does that mean that anorexia can change the brain permanently over time?
Well, that's an interesting question that we don't have good answers to, but there's some possibility that could happen. If you have anorexia long enough and you're chronic enough, it could cause potentially permanent brain changes. They find that when they eat, they're very anxious, so that they pursue dieting, and they may get caught up in a vicious kind of cycle where the more dieting they do, the more weight they want to lose, and so they spiral out of control.
Where does genetics fall in line with anorexia?
If you have anorexia, you have some chance. It doesn't happen with everybody, but you have some chance of having other family members that have had an eating disorder, either anorexia or bulimia nervosa. And if you look at one way of kind of teasing apart how much of this is genetic, how much of this is learned, is to look at identical and non-identical twins, and there's a way of teasing that apart. And if you do those kind of studies, those studies over and over again have suggested that the major contributions to eating disorders is genetic.
Have you found, Walter, that those that develop anorexia have underlying mental health issues as well?
One of the things that we and others have reported is that if you ask people with anorexia what they were like as children before they developed an eating disorder, they'll often tell you that they had a lot of anxiety or obsessive behaviors. And we think that anxiety and obsessive behaviors may create a vulnerability for developing an eating disorder, because that tends to come first in childhood, years before people develop an eating disorder. So these tend to be anxious, kind of obsessive children.
What are some specific things that parents can look out for? Parents of, say, children that have anorexia, what are some things that they can look out for to kind of signs that the child might be going through anorexia?
Well, there's the uncomfortable feelings with eating and seeing themselves as too fat and wanting to lose weight that would be red flags. But just having an anxious child doesn't mean that necessarily somebody's going to develop anorexia.
Okay. Are there any are there any habits that commonly develop within those with anorexia around food that parents could see at the dinner table that they're doing?
It's really a matter of degree. Somebody that wants very low calorie food and is very anxious about eating, and so often we see kind of rituals around food, obsessions around food that may occur.
What are some everyday struggles that those with anorexia might be going through that everyday people don't go through?
Well, they tend to be preoccupied with food and body image, and this takes up a lot of time and energy, and they think about things like that all the time, and it kind of preoccupies their thoughts.
Does anorexia look different in children?
Yeah, sometimes it's hard to. There's another eating disorder now that's been established in the diagnostics manual that we have, which is called ARFID, Avoidant Restrictive Food Intake Disorder, that tends to occur in children. And this is extreme kind of picky eating. There's sometimes anxiety about eating or fears of eating because fears of swallowing or pains in stomachs, and sometimes people develop obsessions about eating certain kinds of food. And in childhood, that sometimes it's very hard to kind of know whether you're dealing with ARFID or an early anorexia nervosa.
How far have we come in our understanding with anorexia, say, since when you first got in the field?
I think that we've come quite a long way. One of the things that's very different is that when people first started to treat anorexia, they tended to feel that the family was to blame, and even did familyectomies, told families that they were somehow causing anorexia, and the solution was to do a parentectomy. And now we have a family-based treatment that where we work with families as allies, and we don't blame them, and we say to them, look, we think there's powerful biological reasons that contribute to anorexia, and these tend to be chronic disorders, and it's important that we work with the families as allies, that the family needs to understand the symptoms their children is having and ways to manage their children at home and get them to eat and maintain their weight. So it's very important that we work with the families, together to help their children recover.
Where would you like to see the anorexia/eating disorder sector go in the future? What needs to get better and what needs to change?
Well, family-based treatment works, but it's not an easy easy treatment for families to do because it involves kind of a lot of struggles and some conflicts with their children. So if we had better treatments, we better understood the causes of anorexia. Hopefully we can come up with more effective treatments that put less of a burden on the family.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Walter Kaye from the University of California, San Diego, where we are discussing anorexia nervosa. So from all that we've kind of spoken about, Walter, we've spoken about highlighting what anorexia is and then a little bit about how we can kind of go about working better with the families. From all we've talked about, what would be the take-home from this interview you'd want people to remember the most?
Well, we certainly like to find some way to cure people. That's always, kind of the goal with any disorder, and I'm not sure if that means medication or better psychological treatments, because we haven't, gotten to that point yet. The other thing I want to say is that the traits that get people, vulnerable for anorexia have some, in some ways they're beneficial kind of traits. One of the things that we see is when people recover from anorexia, and most people end up recovering even if they have a very prolonged kind of course and they're very ill, over enough time, people will end up often recovering. And when they do, they actually do very well in life. And some of the traits that get them into trouble, self-discipline, the obsession with details, they're very achievement-oriented, can be used in beneficial ways. And people that recover from anorexia often do very well in life. And this serves them well in certain professions that reward those kind of traits, like medicine or engineering or finance or research. So that, I always tell parents that not to give up, and that chances are that the child is going to recover and actually do very well in life.
Well, thank you for taking the time to share with us all that knowledge and experience you've had over your career with us today. Thank you very much, Walter.
All right, thank you. Bye.
My guest today was Dr. Walter Kaye, Executive Director of the Eating Disorders Center for Treatment and Research, University of California, San Diego. This was the third installment in our 13-part series on anorexia. Now that we have spoken with a range of academics about the condition, for the next few episodes we will be speaking with those who have had the condition. Tune in next week when we talk with Cherry Boone O'Neill, Pat Boone's daughter, about her journey with anorexia as a young person in the 1970s. And if you like this content, check out the Wellbeing podcast for more. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.